12 things parents can do to prevent addiction. It's our job to protect our kids and keep them safe. We hold them close as they get their first shots, teach them to look both ways before crossing the street, and help them develop healthy habits. We know that keeping children safe from addiction is also a high priority. Here are 12 things parents can do to protect teens from addiction. Number 1. Talk early and often. Children whose parents talk to them about the risks of drugs and alcohol use are 50% less likely to use substances. It's important for teens to delay substance use until their brain is fully developed. The adolescent brain doesn't fully develop until age 22 for girls and 25 for boys. It can develop an addiction more quickly during this time and be damaged more easily than the adult brain. 90% of people with an addiction began using before the age of 18. If your family has a history of addiction, you can discuss this with your child. Stress the need to be more cautious. A genetic predisposition can make a person more susceptible to addiction, especially if use begins early. Number 2. Support healthy activities. Two of the key factors that reduce the risk of kids developing addictions are healthy attachment and pro-social engagement, which means feeling like you belong and being engaged in positive activities, whether it's sports, music, drama, volunteering, or STEM. Kids do better when they are kept busy and feel part of a healthy community. Number 3. Set clear expectations. Be clear with your child that you expect them not to use alcohol or drugs. More than 80% of kids say their parents are the biggest influence on their decision to drink or not drink alcohol. Number 4. Practice refusal skills. Practice key messaging that your child can use in risky situations, such as, "No, I'm the designated driver." "No, I have a big game tomorrow." Or, "No, my mom is strict about that stuff." Number 5. Establish clear consequences. Be clear and consistent about the immediate consequences of alcohol and drug use in your family. Number 6. It's not your job to be cool. It's tempting to want to be friends with our kids, but what they need most is a parent to guide them safely into adulthood by setting clear expectations and holding them accountable. Number 7. Do not provide alcohol or drugs to your teens. It's understandable to think that kids would be safer doing something if we were there to monitor them, but this doesn't extend to substance use. Parents condoning or supplying alcohol to their teens, sometimes referred to as social hosting, increases adolescent alcohol usage, as well as other unsafe behaviors. Number 8. Pay close attention. It can seem like kids need us less as they grow up, but staying engaged throughout the adolescent years is critically important. Build relationships with other parents in your community. Work with them to keep tabs on where teens are gathering and what they're doing. Number 9. Carve out family time. Research shows that spending time with family, bonding over favorite activities, or talking about your days has a long-lasting positive impact and strengthens healthy attachment, even if your teen claims they would rather be doing anything else. Number 10. Make sleep a priority. Sleep is critical for mental and physical health, especially during adolescence when brains are developing rapidly. Number 11. Help your teen with an escape plan. Setting up an escape plan can help your teen exit difficult situations. Decide on a secret code that they can text a parent or caregiver to be immediately picked up and exit the situation. Choose a code word or emoji that signifies they need help with an exit. It can be anything, an emoji, symbol, or a single word or letter, like exit or X. Number 12. Intervene early. If you think that your teen may be struggling with substance use, don't wait to intervene. Science tells us that the earlier a person is treated for a substance use disorder, the better their outcomes. Parents and caregivers can use these evidence-based strategies to promote healthy development and prevent addiction. For more information, visit addictionpolicy.org.